Welcome to today's Ukraine Crisis Response Update. We're focused on the humanitarian situation caused by Russia's invasion of Ukraine. I'm Christine Squires, President and CEO of Americares. And with me here today, we have Dr. Julie Varughese, who is Americares Chief Medical Officer. And we have Adam Keehn, who is our Director of Complex Emergencies. Adam is in Poland right now with the team working on the response. It is hard to believe that it was just 2 weeks ago that Russia invaded Ukraine, and since then, more than 2 million people have fled Ukraine for safety. It's expected that more than 4 million people will ultimately leave Ukraine. The situation is dire. We expect, according to the UN, that 12 million people right now are in dire need of assistance. This is a complex emergency and crisis of epic proportions, and it deserves a global response. Americares is responding. We have our emergency response team in Poland right now. We have a shipment of medicine and medical supplies that has just reached Warsaw, and we have emergency medical teams ready to deploy. So we are able to meet the needs of the coming health crises in the days and weeks and months. We've been doing this for 40 years. Again, we are responding and ready to respond. Adam, I'm going to start with you. Again, Adam is our Director of Complex Emergencies. He is in Poland right now. Adam, you've been assessing the situation on the border. Tell us, what are you seeing? What are you hearing?
Hi, Christine, and thanks for having me on. We're seeing what people are seeing on TV screens everywhere. Refugees coming across the border in trains and buses, in private cars, some even on foot. The flow has been basically nonstop and increased, over the past week or so. These are people, families mostly, many women and children, not so many men because they're being told to stay in Ukraine and fight. And they're carrying all of their belongings with them. It's really a desperate situation, and you can see that in their eyes.
Adam, thank you. And you told me a story the other day of a multi-generational family that you encountered on the border. Can you share that a little more with our audience?
Yeah, sure. We were at the train station in a town called Shemshil, just close to the border with Ukraine, where refugees are waiting to embark on a train to enter deeper into Poland or elsewhere in Europe. And there was a multi-generational family, grandparents, parents, children. I think there were 6 or 7 people. And they had a family contact in Germany they were hoping to reach. But they had everything they owned with them, what they could bring with them. The rest they had to leave behind. And they had come all the way from the east of Ukraine, the Donbas region, which is one that's been under Russian control since 2014. And they did not intend to return to Ukraine. They were leaving for good.
Thank you for sharing that, Adam. And what are the health needs that you're seeing right now in Poland on the border, and then also what you know about inside Ukraine?
Yeah, we're getting requests from hospitals and health clinics in Ukraine, primarily from the city of Lviv, which is the closest large city in Western Ukraine. And they're requesting all sorts of things, everything from regular prescription medications to bandages, gauze, wound treatment medications, antibiotics, and so on. Here in Poland, what you'll see is elderly people who've had to leave without their medications for the chronic illnesses. Our team was interviewing a family in the train station here in Krakow, where I am. And our physician on the team was interviewing an elderly man who was showing her the medications he had for his heart condition, and that it was his last dosage, or among the last dosages he had. And she noticed his ankles were swollen, which is an indication to her of an aggravating heart condition, and was very concerned about what that would mean for him. On the plus side, she told me that in that train station here in Krakow, many Polish private citizens, volunteers, Girl Scouts, you may have seen some on television, who are providing hygiene kits, basic supplies and information to the refugees to help them on their transit through Poland to wherever their final destinations may be.
Thank you, Adam. Julie, over to you again. Julie is our Chief Medical Officer at Americares. As you hear Adam today describe the health concerns, and as you've spoken with him in the past days, what are you most concerned about, Julie?
Thanks, Christine. Yeah, I definitely would echo everything Adam said in terms of the concerns around chronic disease. I think that story highlights what a lot of people are going through. They left their homes, in moments and grabbed whatever they could. Many have left without a significant supply of their medicines that they need to treat their chronic conditions like diabetes, high blood pressure, asthma. So they may be kind of rationing meds, not taking them the way they're supposed to. And we're going to start to see those exacerbations of chronic conditions in the days and weeks to come. I also think about just the mass movement of people and where they're ending up in the neighboring countries that they've entered into. The conditions may be tight quarters, a lot of people. You think about outbreaks of infectious diseases. Certainly COVID-19 is a backdrop to all of this, but a number of other respiratory conditions, gastrointestinal conditions, so definitely expect a surge in infectious diseases generally. And also Adam, mentioned the significant amount of women and children that are crossing borders. And there's so many different things to think about with that, protection issues, especially for women and young girls, gender-based violence, human trafficking, really important issues that, we all need to be very aware of. And then, certainly while COVID-19 is a backdrop to all of this, the other backdrop I would say is mental health. These are individuals, families, communities that have already been through tremendous trauma and then acute trauma with everything that's going on in the last couple of weeks. And so the mental health needs, I think, will be immense in the days, months, years to come.
Thank you, Julie. And I want to come back to a couple of those points. And also, I do want to add that as of 2021, there are 26 million people in this world who are classified as refugees. And we know that of those 26 million, 126,000 have returned only to their country of origin, and about 16,000 have been resettled. So it's really important to underscore, to hear you say this is going to be a long-term humanitarian situation that we need to address. Adam, back to you as we're talking about medicines and medical supplies. So what are you learning about logistics of getting the supply to the people where they need to be?
Logistics have been complicated, there's no doubt about it, but it is improving. On the Polish side going into Ukraine and both directions really, authorities have been trying to facilitate movement as much as they can. It's almost a question of traffic as much as anything. But then there are also issues related to customs, depending on the types of medications that we're bringing into Poland, which is part of the EU, and trying to move into Ukraine. But as I say, things are improving. There's a shortage of trucks here in the Krakow area, but we were lucky enough to make a connection through a friend of Americares, actually, who has been doing business in Ukraine and Poland for a number of years and has helped us to gain access to some of the trucks that he's been using his own personal funds to ship into Ukraine. Trains, as I mentioned, are also a potential vehicle for movement of supplies, and we have a couple of connections to use trains also to get supplies into the country.
Thank you, Adam. And thanks for mentioning the partnerships that we formed and are forming at Americares, because it's really important in these times. We've got to be nimble and quick and pull on those partnerships till we get the medicines and supplies where they need to be. Julie, I want to pick up, well, actually, maybe Adam, over to you first. So, we're talking about 2 million people who have fled the country of Ukraine, who are dealing with unimaginable trauma, something that most of us will never experience in our lives. So can you talk about maybe some of the short-term needs for trauma and mental health care? And then maybe Julie, pick up on that and maybe talk about what we can do in the longer term?
Yeah, well, Julie raised the issue of the psychological trauma that people who are going through this kind of displacement suffer. I think you can imagine, and if you've been watching the news, you can see it on the faces of the refugees, the desperation, the anguish, the fear. It's exacerbated by the separation that almost all families are going through, because it's the women and children and the elderly generally who are leaving behind loved ones and friends. And that kind of psychological trauma, we know from experience, sadly, that it exacerbates the physical health conditions that these people suffer from. And so and actually our Polish NGO partners here are rolling out programs that we refer to as psychological first aid. And just like, regular first aid, these are interventions that are intended to address the immediate psychological and mental and emotional issues that people are experiencing, not to treat them. It's not a therapy. It's really more like an active listening session where a sympathetic person can provide a pair of ears to listen to what the issues are and to provide support and refer people to resources for longer term treatment where that's possible. We're lucky enough to have established a relationship with a Polish NGO right here in Krakow, the Jewish Community Center of Krakow, which itself is then connected to a number of other smaller NGOs in the area. The Jewish Community Center was established originally to help Holocaust survivors living here to make sure that they have everything that they need to survive and thrive. But their doors are open to anybody in difficulty, and they have a Ukrainian flag flying out front, and they've been receiving donations from Polish citizens, and they've been supporting anybody who comes in seeking help, and also providing support to these smaller Polish NGOs that are also providing a variety of services.
Thank you, Adam, for talking about that, especially about the acute needs, psychological first aid, and mental health. The stress and trauma is something that is often overlooked and not talked about, and it's as important as physical health. It's all connected. Julie, again, thinking about mental health longer term, how can Americares help? What have we done in the past? What are your concerns?
Yeah, thanks. Adam really highlighted, I think, the importance of that immediate response is really around comfort and support and reassurance and compassion. And in the longer term, I think about anxiety, depression, post-traumatic stress disorder. I think about people who have been dealing with those conditions before all of this and having exacerbations, but also people who are now going to be dealing with new symptoms of anxiety or depression, and what that means for individuals and families. And often in the context of mental health and refugees specifically, as an organization, we always think about how to support the communities that have fled their home countries. And we also think about how to support host communities. And I think that's an important component of all of this. When you think about the healthcare system at large in the neighboring countries that are receiving Ukrainians, even the most sophisticated healthcare system, doesn't have capacity to absorb the volume of, individuals that are entering into the country. And so as an organization, thinking about ways we can also support the host communities, whether that's through, surge support and staffing. In Jordan, for example, we helped with capacity building. Sometimes there's requests that we receive for technical assistance. So for example, in Jordan, we worked with health centers specifically on incorporating stress management awareness and coping skills for patients who had chronic disease. And we saw really significant improvements in patients who had high blood pressure, diabetes, when they started to have more self-awareness around their stress and had more coping tools, to manage that stress. So I think really keeping in mind ways we can support the refugee communities as well as the host communities. And I think you rightfully Julie pointed out the importance of thinking about mental health as health. And so, our work in Colombia, I think, really highlights that, where in our primary care clinics, we're also providing mental health services. And when I think about refugees who are now navigating a new country and a new healthcare system, having the availability of holistic services in one place will be important. So really bringing that primary care service as well as mental health services.
If I could pick up on that for a second, Christine, I think Julie's point about the pressure on host communities is an important one, and maybe one that's a little less well understood in the general population. Wherever refugees are moving across borders, they have to go somewhere, and where they go are communities which are often in similar circumstances. Now, that's not entirely the case here. Poland is a relatively well-off European country, and yet when you have 2 million, possibly 4 million people coming through, it's going to put pressure on all kinds of systems, the healthcare system, but also the social services and transportation, even all kinds of things. And over time, we've seen in other places like in Bangladesh, in parts of Africa, where refugee populations place pressure on the communities that are receiving them. It can breed some ill feeling between the refugees and those receiving them. That hasn't happened here yet, and in fact, as I described earlier, the polls that I've seen and been working with are nothing but warm and welcoming. But over time, that pressure is going to continue to build, and we know that this is an issue that's going to go on for months and years, not days and weeks.
Mm-hmm.
And thank you, Adam and Julie, and also for mentioning Colombia. I actually just got back from there a couple of days ago, where Americares has 12 clinics, and we are meeting the health needs, immediate and longer term, both mental and physical, of Venezuelan migrants who have fled their country. And I saw firsthand it's a stress on the health system in Colombia, which is why we're there to support. So it's a really, really important point, and thank you for bringing it up. And it just shows that we've seen these situations over and over in different contexts. So I appreciate you're sharing that.
Yeah, Christine, if I could add one other thing.
Sure.
We also have to think about, we're dealing with healthcare systems that have been in the midst of COVID too in the last couple of years. So, health workers, health systems that are drained and depleted, over the last couple of years now, dealing with, the impacts of the crisis.
Very, very important point. Thank you, Julie. Julie, you'd mentioned before a concern, which we see over and over when we have situations of refugees and migrants, about safety for women and girls who are privy to gender-based violence, safety for children and others. So, Adam, can you tell me a little bit about the security situation and what's being done to provide protection?
Sure. As people come across the border, they're leaving a country that is the opposite of secure. There's a war going on. And so their immediate reaction is one of relief, I think, to be in a place where the authorities are being as helpful as they can to provide support. But especially when we're seeing, families with young children, sometimes minors who are unaccompanied, there's a huge risk to them of, bad actors taking advantage of their vulnerability. And so organizations like ourselves, but other NGOs, the UN agencies, are also acutely aware of this risk and are setting up systems in place to make sure that we know where these unaccompanied minors are, and that we're making information available to them as well as to the families and others who are coming across about where they can get support and services. That includes things like phone numbers that they can call to get help. And the authorities, at least here in Poland, have made it clear that their priority is to ensure the safety of the refugees as they come into the country.
Thank you, Adam. So I want to turn for a minute of the global repercussions of this crisis, especially on other humanitarian emergencies. So, for example, how is this going to affect the supply chain of medicines and medical supplies in other countries in Central Europe? Ukraine's an important source of wheat, especially for countries in the Middle East and the Horn of Africa, and that includes Yemen, which is extremely food insecure. And I know that we've worked in Yemen. So Adam, can you share your thoughts on that?
It's a huge concern, Christine, because Yemen, for example, has been in crisis mode for many years now already, Syria even longer, not to mention other refugee crises in Bangladesh and elsewhere. And conditions there are still dire. I guess the only hope I have is that the attention that's being brought worldwide to the refugees here will have a ripple effect of sympathy to the refugee crises that are occurring, sadly, in all parts of the world, as you described earlier. I'm glad you raised Yemen. It's another war-provoked crisis where, the political powers fighting amongst themselves are wreaking havoc and misery on populations who are powerless really to help themselves. It's been an extreme challenge to get support, enough support really to address what's going on there. So as I say, I just hope that this crisis raises everybody's awareness that that there are other crises around the world, sadly, that need our attention.
Thank you. So Adam and Julie, you've both worked on and seen humanitarian crises all over the world. Maybe starting with you, Adam, how does this inform what you're seeing in Ukraine and Eastern Europe, and anything else you want to add from your perspective?
On the one hand, it's different because the infrastructure here is quite robust. There are good roads, good telecommunications, although my internet went out yesterday for most of the day. Generally, things are working quite well. Whereas in many other places where refugee crises occur, the infrastructure of even the receiving country is problematic. And so I guess that's a kind of saving grace in this situation, that people are able to arrive in a country where there are resources and infrastructure to provide support. But as we've been talking about, that infrastructure is being stressed seriously. And as time goes on, that's going to be even more serious. So yeah, refugees anywhere are going to be placing pressure on the countries and communities that are receiving them. That's no less the case here than elsewhere. And as we know from when Syrian refugees flowed into Europe, over the past several years, it created a huge crisis around countries' willingness to accept refugees coming into their countries. And although the initial reception here in Poland, but also in Moldova and Slovakia and Hungary and Romania has been a warm welcome, I think we can expect over time to see that welcome strained. And so it's all the more reason for us to continue to make our best efforts to support those governments and communities that are receiving the refugees coming in.
Yeah, really important, Adam, because, Americares and our partners were there to help support the health systems that we know are going to be stretched and overwhelmed. And that's, overwhelmed. That is one of the things that we will be doing and focusing on. Julie, anything to add?
I think Adam captured it really nicely. And, I hear Adam's voice in my head saying, some of the same lessons really apply to every group of refugees. Certainly, as he highlighted, there's context in terms of location, but some of those same needs are present in every situation in terms of ongoing supply of medications, the need for ongoing access to healthcare, primary care, mental health, and really, I'd say just also the focus on long-term mental health and traumatic needs and support there.
Thank you both so much. Adam, thank you for joining us from Poland. I know you're incredibly busy, but we appreciate, your sharing what you're seeing, the work we're doing, what you're hearing. Please stay safe. Julie, as always, thank you for joining us and for your perspective and your comments on the health situation. I do have an ask before we wrap up because we're almost at time, but I want to thank all of our supporters for joining us today. It means that you're curious, you care, you listen. This is unimaginable, terrible crisis. Our heart goes out to everybody in Ukraine and everybody fleeing, all the refugees who are going through a terrible situation. I know many of us have family, we have friends that are in this situation. So thank you for joining. I am going to ask, we do need to raise money for this crisis. We are looking to raise $20 million for this response in the near and the long term. So please, if you can help, go to Americares.org/Ukraine. We are committed to saving lives and improving health in this crisis and every day around the world. Again, thank you for your support. Please go to Americares.org to learn more. Thank you again, Adam and Julie, for joining us today. Thank you.
Thank you.
Thanks, Christine.
Thank you.